favorite I-94. Good morning. It's all proudly brought to you by Cabos Insurance, Ambrose Inc., IT&E, Coast 360, and the Bank of Guam. Let's go to the phones here where we have Dr. Vince Duenas from Take Care and FHP. Good morning, Doctor.
Good morning.
Hey, good morning, Chris, Sabrina. Thanks for having me.
Well, thank you.
Our pleasure. So we've got a regular line open with Dr. Hoa from AMC, of course, and they were designated as one of the Tier 2 clinics that we know that FHP was as well. So we kind of wanted to bring you on, and if you could, maybe, first of all, to talk about how the clinic's response to COVID-19 has gone during this pandemic, if you could, Dr. Duenas.
Yeah, definitely. I think FHP Clinic, when we got the call to respond as a Tier 2 facility, we were quick to rise to the occasion. We had two primary roles as a Tier 2 clinic. Number one was to serve as an alternate testing site and triage facility for COVID directly. And then number two, to serve urgent care cases in order to alleviate burden on both GMH and GRMC. When the island first got the initial cases, it sort of created a panic, and the public, for any symptom related to COVID, quickly flooded the emergency rooms, and the whole Tier 2 model was created in response to that.
And so when that executive order came out, how did it then affect you guys, and what type of service were you? Because you guys were basically deputized to help fight COVID on the front line. So what did that entail?
Yeah, we definitely changed up our entire clinical operation. So that meant clearing up our entire schedules, canceling all non-essential clinic visits in order to help serve the hospital. So in anticipation of a potential surge of COVID-19 patients, we kind of just cleared the schedules and stayed open, waiting to assist in any way possible. At one point, we even talked about converting part of our clinic and our urgent care into a makeshift hospital if we needed to. And at FHP, we really have the capacity to do that. We have a lot of experienced physicians, experienced nurses. A lot of our nurses are emergency room nurses. And again, there was a lot of uncertainty in the beginning, but we were just ready to respond.
Right. And so are you guys still responding as a Tier 2 clinic, or has that designation for you guys been lifted at all?
We still do. We still run a testing facility outside of the clinic, kind of like a drive-through testing site. Public health has taken over a lot of the direct testing, but we still operate in that capacity. Slowly, we are opening up our clinical services to more preventative health and calling our patients back to get checked up. But yeah, we're ready. GMH and GRMC are filled to capacity with non-COVID related illnesses, and I think now is the time where we got to shift our focus back to preventative health and chronic disease, because our island has tons of it. And when we talk about COVID-19 morbidity and mortality, we already know that the top two risk factors for those things are heart disease and diabetes. And I think now's the time, since we've had the outbreak under control, to focus on treating heart disease and diabetes in order to prevent potential complications. And chronic disease is the top killer in the country. COVID has claimed nearly 100,000 lives in the U.S. so far. Heart disease alone killed 600,000 people in the U.S. last year and every year. So if we know that these are the risk factors for complications related to COVID, then I think we need to shift our focus back onto this. And this is where the Tier 2 clinics come in. FDA, AMC, and FHP combined are the largest in healthcare service delivery on the island and in Micronesia. So that's the role we play at this point.
Right.
I think you're right. The COVID-19 has not only shown how resilient we are as a community, but it also shows how unhealthy we are. If you're saying that both hospitals are filled to capacity.
Yeah, yeah. Yeah, and so, chronic disease is something that our island has struggled with prior to COVID. And before COVID hit, we already had a very fragile healthcare system. And I think with the CARES Act funding, and I know they had at least budgeted for some money to go to the clinics, I think this is really the time to fortify our healthcare system as a whole, on all levels, from public health to inpatient care at GRMC and GMH to ambulatory care with the private clinics, in anticipation of any outbreaks in the future, and not just COVID, but any other pandemic that might hit our island. And this is a time to just change the entire healthcare landscape for our island.
Did you say that during when you were designated as a Tier 2 clinic, you had to how did I say, like slow down your regular patients, like from coming in? You put everything on hold, right, just to be the Tier 2 clinic?
We did because there was a lot of uncertainty in the beginning. We didn't know if there was going to be a huge outbreak, and we didn't know if we were going to get flooded with urgent care cases. And so all the non-essential visits, people coming in for like medication refills or blood work or just preventative health physicals, we rescheduled and just kept the schedules open, ready to take on any walk-ins.
But this Tier 2 designation, it's going to remain in effect as long as this public health emergency declaration is in effect, correct?
Correct.
Right. And so the governor's indicated that this is she's likely going to extend it for another 30 days. Are you guys going to, I mean, like you said, I don't think there's a lot of people rushing to the clinics at this point, right?
We're starting to see more volume these days. And
for testing?
Not for testing, but just regular follow-up.
Yeah.
Public health has done a great job with testing. We still see some walk-ins for testing specifically, but I think now that the initial pandemic has been under control, people are feeling more comfortable coming out to the clinics. Mm-hmm. We also have implemented our patients safe when they do come in to get seen. But if we are designated Tier 2 for another month or so, we will adjust as the situation calls for, and we will remain ready to assist in any way we can.
Right. Doc, this is something that we kind of been following a little bit, and we're able to FOIA the emails. So we wanted to get you on and present the facts that you guys were called up basically by the governor to assist with the COVID-19 response through the Cures team,
right,
which is led by the surgeon cell state surgeon Dr. Mike Cruz.
Right.
And so what I was able to FOIA was all the correspondence between the governor's office and the Tier 2 clinics. And where we are today is, I'd asked the governor last week, when are these Tier 2 clinics going to get paid? Because like you said, obviously you guys were called up. You've provided a service at the direction of the government of Guam with little to no paperwork, apparently.
Right.
What I'm looking at here. And so come to find out that you guys haven't got paid a single penny, and that the government of Guam and the administration is now saying, when I asked the governor, hey, what are we doing about paying these clinics? He said, oh, well, how I work is I need an invoice, and then I would pay him. And so I was like, okay, I took that at face value. But then when we got the FOIAs, we found out that there can't be an invoice, really, because the Cures team is supposed to, per the executive order, come out with SOPs and a whole billing schedule and all that stuff. So that hasn't happened, right? So that has not happened. So basically, you guys are running your operation into the ground, and we're also hearing from AMC that, it's a burden. I mean, you guys are answering the public health emergency call, but let's be real, it costs money. And you can't have an invoice, you can't send a bill until the Cures team creates the framework for that to happen. So how has that been not getting paid affected your operation over there at the clinic?
It's been tough. The healthcare industry as a whole has been hit hard by COVID. Not every small business qualified for federal disaster relief, like the Paycheck Protection Program and economic injury disaster loans. And so we have had to make very difficult decisions as an organization. Everything from pay cuts to reduced hours, to even furloughs, unfortunately. These are obviously decisions of last resort and not unique to Guam. This is actually happening all over the United States. And it's discouraging. It's sad because this is a public health emergency, and I think healthcare should be the top priority. I know the governor did budget at one point for the $7 million for the CARES Act funding toward the Tier 2 sites, and I really hope that does come to fruition, because obviously the more money we have, the more resources, physicians, and nurses we have, and that equals better access to care, and better access to care results in better health for the entire island. And I think our staff at FHP and the other Tier 2 clinics do an excellent job. You'd be surprised at how much we can do in the outpatient setting to support what's going on in the hospitals. And so, yeah, it's been tough. We've been having to be creative, but we had a healthcare shortage of doctors and nurses prior to COVID, and to now be in a position where we potentially are going to have to lose more is concerning.
Right. So have you had to let go of doctors, Dr. Duenas?
Not yet, but I can say that a few physicians have been given notice.
And so I want to go to the emails that we have had. I'm going to read just a passage here from the Book of Legal Counsel. Sorry. So I was reading this email from April 23rd, and I got this FOIA last week, and it was just funny to give a little bit of context. I got this FOIA about the same time that they had the oversight hearing for the procurement of the hotels. And so we had this whole hearing where they were trying to justify paying out these hotels through this emergency superpowers route that they did it. They couldn't tell us anything about it. They claimed executive privilege. And so they used that process to pay these hotels, to pay a couple vendors. But then they totally moved out of that superpowers lane and then went back to the by-the-book procurement process. And so I watched this whole hearing where you had the legal counsel and policy director Carlo Branch, not just attempting to answer questions for people, but not answering questions that needed to be answered. And also continuing to justify the way that this emergency purchase was handled.
Yeah.
And so I thought, when I want to read this passage to you, and this is a letter that the legal counsel had written to your attorney. So basically, all the clinics have lawyered up, and that's where we're at now, is they're negotiating with the administration to get paid. But again, going back to you guys getting paid, you can't do that because the Cures team hasn't come out with the framework for it. This is a letter from the legal counsel to your attorney, and it says here, we fully support your involvement as a Tier 2 clinic. However, we need more direction from the Physicians Advisory Group, which includes your client or a designated representative. We have not received any indication that any medical facilities, supplies, or providers have been formally directed to act as government entities.
Mm-hmm.
This would have been in the form of a contract for procurement purposes. And as you know, procurement law does not allow for payment of services prior to the execution of an agreement. And I wanted to read that passage from the Book of Legal Counsel because I just couldn't get over how ironic it was that when it came time to pay you guys, obviously you guys did a service. The answer was, we can't pay because there's no contract and we don't have any paperwork. But when it was time to pay the hotels, no contract, no paperwork, no problem. So how does that sit with you guys? I mean, it's got to be a little frustrating.
Yeah, I mean, it's tough, and I hear a lot about the receipts and reimbursement, but I think it extends beyond that. Now, if the tier two, first of all, I think the tier two model is an excellent concept, and the tier two clinics, the three of us, again, are the largest healthcare service delivery component on the island. And I don't think the funding needs to be directly related to reimbursement. Now, if you have clinics saying that we took huge losses just from COVID alone, I think the focus should be more on stimulus funding to help support those clinics in order to strengthen the healthcare system as a whole. Because we all are part of a very well functioning system, and if one component is affected, then everything is put in jeopardy. And so, with receipts or without receipts, I think the CARES Act funding allows for our government to provide stimulus to people who need it. And clinics and healthcare should be top priority.
What do you make of that passage, though, where it says that the legal counsel writes, "We have not received any indication that any medical facility, suppliers, or providers have been formally directed to act as government entities." And I spoke with another attorney who's representing one of the clinics, and they said, basically agreed, how could they write that sentence when the executive order did exactly that? The executive order was a formal directive to you guys.
Yeah.
I mean, yeah. I just don't understand it. Like, how do you write that when the opposite is true?
Yeah, and again, I don't know. It's tough and to hear stuff like that, and we have a great management team, and I'm not directly involved in any of those administrative or legal discussions. I'm purely just a clinician, but whether or not we were designated a government entity in response to COVID, the bottom line is that clinics are hurting, and we're asking for support, and I think CARES Act funding allows us to get that sort of relief, especially during a public health crisis. If this was an attack from another country, our top priority would be defense and national defense and military. But this is a healthcare emergency, and we need to do everything possible to strengthen the healthcare system.
Well, we're talking about all these emails. What about, I think the clinics are also on the Governor's Physicians Advisory Group. I think there's representation from AMC, right, from FHP, from SDA. And so the Physicians Advisory Group, they talk with the governor every week. I don't see why this has not been brought to the table, or has it? Instead of dealing with emails, what's being discussed face to face?
Right.
And why isn't there any resolution when these clinics are part of the Physicians Advisory Group? It makes no sense.
Yeah, I agree. And there's a lot of focus on very specific things like testing capacity. There's a lot of focus on ventilator capacity and hospital beds and all that stuff. But again, I don't think, personally, I feel that the focus should be on prevention. And I think that that's where the tier 2 clinics come in. And I think the Physician Advisory Group is tasked with doing other things in terms of what protocols need to be put in place for opening up the economy, and things like that. So I think that is what goes on in the meetings. And,
well, we had heard from Dr. Ho. He was basically like, look, we are a tier 2 clinic at AMC, but I don't feel that the Physicians Advisory Group is the setting to bring up this grievance about not getting paid. That's what we were told from.
But I thought the Physicians Advisory Group, I thought you were mentioning that in the executive order is supposed to come up with the MOA and the reimbursement rates. But members of the Physician Advisory Group are tier 2 clinics.
I think that would be. I think that would be the perfect forum to make this argument. Correct.
Yeah, it just kind of like, well, you guys should know because each of the clinics are represented on this physician's advisory group that
Yeah.
are being served, that are serving as a tier 2 clinic.
Right.
And so, it just seems like you would communicate that and everybody knows what's...
You see Dr. Mike Cruz around, you ever be like, hey, Doc, what's going on? How's
Well,
that MOU SOP thing going?
Yeah. So yeah, I mean, if the discussion isn't being held, then I can see why we're in this situation. You know, to start with, because the governor's not going to know what she needs to do. She's not going to know the urgency of the matter if it's not being brought up. And
I see.
You know what I mean? That's
Yeah.
so. If it's not happening at that level, it has to.
I mean, clearly she doesn't, or at least she didn't portray a knowledge of this issue, because when I'd asked her about it, she said, oh, well, we don't have an invoice. Well, if she knew what the real situation was, I don't think she would say that, because she would know that you don't have an invoice because the body that you tasked with creating a way for these doctors and these clinics to invoice you has not stood up that framework. So when do we reach the point, Doc, where you guys say, we want to be a tier 2 clinic, but God, we're firing doctors? I mean, are you guys going to throw in the towel anytime soon, or where are we?
I don't think so. I mean, we have a duty to serve the public, and we're going to do that in any way we can. Whether or not we're a tier 2 facility, we're going to be creative, and our top priority is serving the people of Guam. We got a great team at FHP, upper management that can help us make decisions to keep the doors open. Obviously, the more resources we have, the better. But it's not going to stop us from serving in our primary role, and that's to take care of people.
Right. I think it's just unfortunate that you guys are stepping up, being a tier 2 clinic, and then having to lawyer up. It's just it's really sad.
It is sad, and our private sector frontliners are now having to fight to keep their jobs, and it's very, very disheartening and can be discouraging at times. But we're not going to lose focus of what is at hand, and that's to help the people of Guam.
Well, thank you for that, Doc. And
Thanks, Doc.
we're kind of just running this, and we'll talk to a few of the other clinics, at the end of this week, and then into next week, and then find out where, obviously, the Cures team is with standing up these MOUs, MOAs, and the SOPs, and all the other 3-letter things. It's just, I don't get it. And talking to the attorneys, I mean, the vibe I'm getting is they're kind of worried that, they're not in a good spot right now, because we just had a whole oversight hearing where everyone was getting dragged through for paying out things with no paperwork. And now here you guys are with no paperwork. So
Yeah.
yeah, ouch. Thanks, Doc. And, keep us posted, okay? And I got your number. Let's make this a regular thing, definitely.
Yeah, we'll do. Thanks for having me.
Okay.
Of course.
Good day.
You
Take
too.
care.
Wash your hands.
We'll do.
Okay. Thank you.
You telling a doctor to wash their hands.
Man, that is just something else that, I don't know, in my mind, I'm just like, okay, we paid for meals, we paid for the hotels, we use this process that
Paid for laundry.
We use the process that the governor continuously said was okay and that she had the authority to use, and then they drove that car off into the ditch, and now we're doing the regular way, which begs the question, where does that leave these tier 2 clinics? And was this an oversight on the part of who messed this up? Is it a mess up? Well, people aren't getting paid, and doctors